and welcome back to Canna Chat. My name is Cherissa Jackson. I am the Chief Medical Executive of AMVETS. Thank you all who watched the very first episode of Canna Chat. We so appreciate it. For those of you who didn't watch Canna Chat and this is your first episode, welcome and thank you. So what is Canna Chat? Canna Chat is a monthly discussion with leading experts who's going to talk about everything cannabis. And I'm so happy to have my second guest here today, Dr. Dahmer, and he's with Vireo. So those of you who watched the first episode, he is a partner with Dr. Paloma. So welcome, Dr. Dahmer, to the show. I appreciate you being here.
It's such a pleasure to be here.
So tell us about yourself. What do you do? Why are you interested in cannabis? And what kind of work do you do out in the community?
Well, I think, in my soul, I'm a family doctor. And so I have always been. I trained at the University of Wisconsin-Madison for medical school, did residency at underserved populations in New York City, in Manhattan, so mainly serving the Lower East Side, and dedicated my life to family medicine. Early on in my career, I saw that Western medicine didn't have all of the answers, and I oftentimes was treating a symptom rather than getting to that underlying cause or going upstream. And so embraced integrative medicine very early in my career, and actually did a fellowship through Dr. Well's program in the University of Arizona in integrative medicine, which led me to travel the world, practicing medicine from New Zealand to Brazil to Southeast Asia to Palau, and also learning about medicinal plants. And that's really, what triggered my interest in plants, is seeing around the globe that the majority of the world's population uses plants as our first line in terms of our medicines. And it's, accepted throughout the globe. And, in New York City, we go to Walgreens or Duane Reade, and it usually comes in a pill form, but that's really not the reality for most of the inhabitants of the world. And fast forward about 6 years ago, that a very close colleague of mine, Dr. Kyle Kingsley, founded Vireo and asked me, hey, do you want to get into cannabis? And admittedly, because of the stigma surrounding this plant, I don't know anything about this. And all I've heard about it is that, there's a lot of addictive potential and the same thing that we hear all the time. Yeah. But with my background in medicine, I dived into it right away and saw, there's tremendous potential for this plant. And it's been 6 years, an amazing ride, and we're going to get into it.
Yeah, absolutely. So let's start with integrative medicine, right? For those people who aren't medical like you and I, what is integrative medicine?
Yeah, so integrative medicine is really taking the best that's available of all modalities to help that patient in front of you, right, in a nutshell. And that means that integrative medicine, in that fellowship, I learned about nutrition, which in my medical school training, I had maybe an hour of nutrition, believe it or not. I learned about other modalities from Chinese medicine and acupuncture to Ayurvedic medicine. I learned about herbal therapies. I learned about supplements. I learned about a lot of modalities that Western medicine might consider outside the box. And 20 years ago when I did that fellowship were frowned upon, we might say. And now, it's really blown up. I was on the phone yesterday with a physician that runs the integrative medicine program at Mayo Clinic.
Wow.
And every major institution has an integrative medicine, either center or department.
So would you say it's a comprehensive, holistic approach to medicine and treatment?
Comprehensive, holistic approach, taking the best of multiple modalities and applying it to the person in front of you. Really personalized care as well. That, it's not a one-size-fits-all. That you can utilize multiple modalities to really get to a person to a point where they either have relief or upstream where potentially even prevention of that disease comes into play.
So where does cannabis play in all that? We know it's a plant, but where does cannabis play in all of that?
Yeah, I think, one of the things in working with plant medicine that really opened my eye is a criticism from a Western medical paradigm is that plant medicine is not strong enough, right? And I think that makes a lot of sense. A lot of our modern medicine comes from wartime medicine, comes from emergency medicine that, if something severe happens to my leg, I want an opioid, right? I want that pain relief quick. But what we're seeing in medicine now is a shift to chronic diseases. We don't need the huge hammer coming through that then we're chasing side effects to. And plants have that softer impact on our physiology that we can use for a longer period of time, in my opinion, without constantly chasing those side effects. And I truly believe that cannabis fits in that realm.
So how do we change that perspective in the community? Because a lot of people want that quick fix. Give me that Percocet, give me that opioid, give me that morphine, and I want to get rid of that pain really, really quick. So how do we shift that paradigm?
Well, I mean, I think a lot of it comes back to education. You know, a show like this today to talk about that even cannabis is not a panacea. We're not going to come to our dispensary here and say cure everything. We're going to utilize it as a tool in that integrative approach to help me to feel better in the long term. And that quick gain sometimes might set us back a year or 2 years down the line. So that education is going to be kind of that first arm, and just talking about, hey, let's get slow, steady progress in a chronic disease is a huge win as long as we keep that momentum going.
And you know, when I was in nursing school, one of the things that instructors would say to us when we were administering pain medication is you start slow and you give it a low dose. So it's kind of like the same concept with cannabis, right? Until you really know what dose works for you, you have to kind of start slow and ease into it. Would you say that's a good approach?
Yeah, no, absolutely. And what I love about integrative medicine is that, you know, I don't shun modern technology. I embrace it. It's a huge part of my practice as a clinician, and this is where these two worlds can come together. We can study the plant, and when I ingest it, or take it by my mouth, or if I inhale it, or however that does, we can study what happens in my bloodstream, right? So how does that impact the levels in my body? And one of the things that's been shown is this biphasic dose response, which is a fancy way of saying less is more. Not only should we start low and go slow to try to avoid potential side effects, the best we can hold at that lowest minimum dose. And that's where it becomes so personalized. Your lowest minimum dose is going to be different from mine.
Yeah.
I'm not saying higher or lower.
Yeah.
It's going to be different.
Yeah.
But I need to find where that is. And we'll talk a little bit about the clinical trials where we're trying to get better answers. Because in my opinion as a physician, start low, go slow. We need to be a little more specific than that.
Yeah.
But it really is a paradigm shift in medicine in that the patients are in charge.
Yeah.
Everyone that's walking through here, we're not saying you're taking 10.5 milligrams when they walk out the door. We're saying you have to find that sweet spot, which will be criticized by modern medicine in many ways, but in other ways it can be very personalized in finding my right dose.
And it gives the customer, the patients, that ability to choose for themselves. If they need a little extra, if they don't need as much, they get to monitor that. They get to decide for themselves and be their own advocates, right? To decide what they want to do and how much they want to do of that particular medication.
Well, and that's, for me, that's where that big picture becomes so strong.
Yeah.
Because I think a lot, our history of medicine, that doctor was the know-all, right? And we almost couldn't do anything without that doctor. And in my experience, even as a primary care physician, I worked with organizations where we changed that paradigm, and that empowers someone. Rather than do this to me, or I need to be fixed. And this is one of my favorite kind of discussions or analogies I talk about is we used to think of a doctor as a mechanic. The car is broke, let me tweak this, a surgical approach sometimes, let me fix this. And the paradigm is shifting to that of a gardener. Right? Let's give those right nutrients. Let's give that right atmosphere. Let's give enough oxygen. Right? Let's give those qualities that are going to allow health to flourish. And that's a big paradigm shift that then empowers, the plant itself to grow strong. Rather than I need you to fix something in order for me to have any form of health. No, I can cultivate health on my own in conjunction, right? In relationship with this plant.
Yeah, almost like you're teaching users to fertilize. The cannabis, you're going to fertilize it with whatever you decide to use it for and however you decide to use it.
Again, it's one of those inputs, right? It's one of those tools that if we talk about, maybe a very concrete example, something I hear from patients quite a bit, and I gave a lecture at Burke Rehabilitation Center in New York, a big rehabilitation center, many patients with Parkinson's, and someone stood up and screamed, I take your blue product before physical therapy.
Nice.
It loosens up my muscles, I'm able to participate, I'm able to do much more. So cannabis is used as a tool, right, to augment my activity, my physical therapy, that we know starts to spiral in the right direction, right? So I don't just take a pill or I puff on a joint, right, and that's it. No, let me utilize this tool to do some of the other things I know that will also bring my health back.
Absolutely. So let's talk about pain, because I know that's a topic that you love to talk about. And as you know, in the veteran community, a lot of veterans suffer from different types of pain, chronic pain and things of that nature. So how can cannabis be used to help veterans who are suffering with chronic pain?
Yeah, I think that's a fantastic question. Before I jump in, I will just say that pain is daunting.
I know, it is.
It's my favorite thing to talk about. I think it's the number one reason that anyone is coming through a dispensary to get cannabis, and I think that's kind of what pushed me in that direction. Even prior to cannabis, I wrote a chapter on integrative management of pain because it is so challenging, right? And the one thing that really surprised me about cannabis is that if we think about pain in a simplistic manner, right, we have nerves, right, even at the end, right, in our hand, in our skin, that's one perception of pain. Those pass through the spinal cord, right, which is another gate or is another way to modulate or change pain. And then we have our brain, right? And so there are kind of three aspects of pain perception that are all very important. Cannabis is the only therapy that I know of that can address all three. And that really fascinated me from the get-go. And the other thing that really just turned the corner for me, and it's not a reason in itself to use cannabis, but it's something that we use a fancy term called the LD50. And that means that it, you know, in a nutshell, it's virtually impossible to die from a lethal overdose of cannabis. And in the midst of an opioid epidemic, this really serves as a very remarkable tool to utilize in these three areas of pain perception to give some relief.
And you know, in nursing school, I always think about what the instructors would tell us about pain is what a patient says it is. So I can say I'm 5 out of 10, you can say you're 2 out of 10, and then I can ask for a Percocet and you can say, well, I don't need a Percocet, I may need some Tylenol. So how does the pain threshold, is an indicator you should use to determine how much cannabis you should use?
Yeah, let's unpack that because it's a tough one. As you know, number one is pain perception, right? And we have to start out, one, we're very different, each and every one of us, whether that's our genetics or our background. Two is, you know, our ability to metabolize drugs is going to be very different, right? And that's going to play an important role. And then similar to your, you know, kind of experience in nursing school, I still remember from med school that one of the lectures where I was kind of described pain, the idea or the analogy that came up is, you know, a kid, right? I'm playing baseball and I just caught that fast pitch, that smarts, that really hurts.
That stung.
but that struck out the batter to win the game. Right? Versus that exact same pain, I'm getting slapped by my mom because I did something wrong, right? And again, one I'm going to be celebrating, and the other one I could be in the corner crying, right, as a child. And that's just how different even pain can be perceived. And so it is so complex, right, and so individualized for each person that we need therapies that fit the individual, right? And cannabis is like that too, where our dose could be very different, or even the product selection could be very different. I have that flexibility that it's not a one-size-fits-all. And I can work with my team, as the patients coming through here right now in our dispensary do, to find that right sweet spot of that right product for me.
One of the things I saw a lot on the battlefield in Iraq and Afghanistan is troops coming off of the battlefield, particularly with amputations. And of course, you and I know it takes a while for those nerve endings to die off, and they used to be in excruciating pain. Would cannabis be an answer to a veteran who may be suffering from phantom limb pain or any type of amputation, pain from amputations? Would they be a good candidate for cannabis?
Yeah, and again, I think answer is the key word. I think that to not explore cannabis, in my opinion as a physician, is a disservice to that veteran. The reason being, one is notoriously how challenging that is to treat. And neuropathic pain is one of the biggest challenges. Even a primary care physician, neuropathic pain is a huge challenge. Some of the best evidence that exists for cannabis right now is in the treatment of neuropathic pain. The randomized double-blind control trials that exist that show positive impact, the majority of those are with neuropathic pain. So this is a modality that at least should be explored. And again, the problem oftentimes with integrative medicine or cannabis is this becomes that treatment of last resort. And we're going to go through, you know, a slew of medications, many with severe side effects, before we even consider cannabis if it's on the docket, which is a mistake. And yeah, absolutely. And we see reflex sympathetic dystrophy is, you know, another very severe pain syndrome that we see success stories with cannabis. And phantom limb, certainly neuropathic, and these are perfect examples where cannabis should be a modality that is potentially offered to patients that are suffering from those.
What I'm hearing from veterans in the community is that they're coming off of opioids because they're tired of the side effects of opioids. And of course, we know that there is a suicide epidemic because a lot of veterans are on opioids. So what advice would you give to a veteran who's hearing this, watching this show, and they're thinking, man, I've tried everything. and it's not working. Maybe I'll try cannabis because I do have the neuropathic pain that you're talking about.
Yeah.
What would you say to that individual?
Well, I would say that you're already doing it. You're watching this show, and the first step is let me learn more about it, right? And any tool. Let me get to know that tool a little bit more. Is that right for me? Is it something that I want to explore? And then, as you well know, you have to be your own advocate.
Yeah.
You have to find somebody that's going to work with you. And ideally, that's your primary care physician, which we know is not always true.
Yeah.
And so you may have to search out someone else to support you on that path to explore it. And learn more about it, and don't be afraid to advocate for yourself to try it. And again, a lot of people talk about the addictive potential of cannabis, and I'm never one to talk down a shadow side of a medication. Yeah. Every medication has its shadow side. But we're seeing some fantastic research, and some of it's coming out of the MIND study, and this is Dr. Stacy Gruber at Harvard, that we're not seeing those levels of even cannabis use disorder for those that are using it in a medical setting, right? And this is very reassuring. In addition to that, we're seeing improvements of quality of life. We're seeing improvements in sleep. We're seeing a lot of benefits, and certainly anecdotally we hear from not just veterans but patients on a daily basis of decreasing their opioid use. And the key thing is don't go cold turkey.
Yeah.
Take your time and get, slowly work up that cannabis dose again to that sweet spot. You're not having any side effects. Take your time to get there. And as you're feeling some relief in that sweet spot, then the opioid dose comes down. And different physicians will have different strategies. I know certainly physicians, some in California, will go almost cold turkey. In my experience, that can cause a lot of withdrawal, could even be dangerous. Take your time going either direction and work with your provider. Work closely with your provider on how these two could even potentially synergize. And there's research to show that cannabis and opioids can synergize, that we can have a better impact of that opioid drug, right, in terms of pain relief without changing the dose when cannabis is added, without that negative impact where the two could negatively synergize, where my respiratory, or my breathing might stop, like benzos can or alcohol can. So it's an ideal potential candidate for those that are looking to decrease opioids or get off of that. And we're going to talk about a little bit later, but we're in the midst of 2 large-scale clinical trials that we're supporting that study just that. Nice. So again, we've planted the seeds, and 1,000 more need to be planted to have good data that can inform those that want to make that move. And again, all I can say is you need to work with a healthcare team. You need to be very careful as of right now, and hopefully in the future, if we continue to advocate, we'll have better research to really give a container. This is how you do it, and plenty of providers to support you on that path.
One of the questions that came from the first show, and I do believe a lot of people are out here thinking the same thing, is, hey Cherissa, you want everybody to be on weed, you want everybody to be high, and then people are going to be addicted to cannabis. How do you dispel that?
Yeah, I mean, I don't sit here, just reading, papers about cannabis. I was frontline, giving in the dispensary, giving consultations to those that are actively using cannabis. And in that front line, over and over, Doc, I don't want to be high. And this is the majority of our patients. We treat being high, right, or intoxicated, that is an unwanted side effect. And that just is over and over, time and time again. These are the patients that are walking through our doors. And many, it's very easy to get pain relief without being intoxicated. And again, we have to creep up to find where that sweet spot is. There may be times where a little bit of euphoria creeps in and we have to come back, but that we can easily treat as an unwanted side effect and get pain relief without that feeling.
Wow, so what you're saying is patients just need to come into a dispensary or find a doctor or find a consultant in the community that can educate them on how this plant can help them.
Yeah, and work with someone that's knowledgeable, and there are things that, research, the research that's growing is starting to show. We did a fantastic research project with the University of Minnesota, Dr. Angela Birnbaum, showing that if I take an edible or a capsule or anything that goes through my stomach, if I take that with a high-fat meal, it could have 14-fold the peak dose right? It get 14
Wow.
times, right, that highest dose that it goes
Yeah.
in my blood. 5 times the median, right? The average could be 5 times.
Yeah.
And so little things like, do I take this with a high-fat meal or on an empty stomach, make a huge difference. That could be the difference between, hey, I got pain relief versus I'm feeling anxious or having those side effects, or even that worst-case scenario, I have to go to an emergency room.
Yeah.
And so those are things that we do have to be careful with. Am I taking this on an empty stomach? Am I taking it with a fatty meal? Am I on other medications that might affect metabolism? And that's where having that team that's a little bit more knowledgeable, not just our dispensary staff and the pharmacists that are associated with that, but your own healthcare providers, making sure they're in the loop. They
Yeah.
should be aware of that. And we've talked about that before. One of my biggest pet peeves is, as a physician, if someone tells me they're using heroin on the street, I don't turn them away. Tell me more about it.
Yeah.
How can I help you with that?
Yeah.
How can we reduce the harm that's associated with that? You know, cannabis, same thing. Any physician should at least be open to the discussion. What are you using? Where are you getting from? How do we know it's safe? What dose are you taking? Could it impact other medications? The same things we do with any other medicine.
Absolutely. So we're about to wrap this up, but before we go, I want you to talk to us about those studies, those research studies you were telling us about, and anything else that you have on the horizon with Vireo.
Yeah, I mean, well, one, I just want to thank you, because again, I don't think we call enough attention to how hard the work is that you're doing. And I have knocked on the door of the veterans many times and have been turned away many times, and have worked directly with a patient that cannabis impacted their life positively and had to go away from a pain clinic at the Veterans Hospital. And we know how difficult that is. So I just want to applaud the work that you're doing, and for giving us this venue to be able to share some of the things that we're learning. And to speak to some of the clinical research, we've been very fortunate to partner with Montefiore, originally Dr. Chinasso Cunningham, now Dr. Julia Arnston, where there are 2 very large-scale clinical trials. The first is a memo, $3.8 million NIH trial, looking longitudinally, so observing patients in the New York program that enter the program and receive medical cannabis that are on opioids and are treating chronic pain. How do they do?
Yeah.
The question just really hasn't been followed too closely.
Yeah.
And so this is ongoing. We're probably going to wrap up pretty soon the enrollment, and hopefully in a shorter, not too long of a period of time, have some answers to better inform more people that go down this path. Very exciting, called the MEMO trial. It's listed on clinicaltrials.gov. And the other is absolutely groundbreaking randomized double-blind control trial, again with Montefiore and that tremendous group there, where for the first time we're looking at one of our higher THC products, our yellow, versus our green, which is a 1-to-1 THC to CBD, versus a high CBD product versus placebo. And very titrated, very close validated measures following these patients in these different arms. Which one works best?
Yeah.
How does that impact opioid use? How does that impact their chronic pain? How does that even impact potentially cannabis use disorder or depression or anxiety? Very exciting studies that, again, just scratching the surface, and wow, that would be a whole podcast to discuss how hard it was to get those going.
I bet. So if anyone's interested in those research projects, how should they find you, or where should they go?
Going to vireohealth.com, there's a research project, a research part of the page, which is a quick link to that. Certainly, I'm on Instagram, I'm on LinkedIn, I'm on Twitter. I'm easily Googled out there, so you can find me pretty easy. And we are always in need of participants, that are going to help us get better answers to inform. This morning we talked about 5.4 million Americans in state legal programs are using cannabis. 5.4 million people are using this where policy went in front of the science, and the science is stifled. We need to break those barriers to get better answers.
Absolutely. Well, thank you so much for being here today on Canna Chat. I really appreciate it, particularly on topics such as pain, because we have a lot of veterans that are in pain or using opioids, so I thought this was very important to have this conversation right out the box. So I appreciate you being here. Thank you so much.
It's such a pleasure, and thank you for all the work that you're doing, and look forward to more.
Absolutely. So for anyone who's interested in Canna Chat and want to be a guest on the Canna Chat show, you can certainly reach out to me, cjackson@amvets.org. Thank you all so much for watching, and hope to see you soon.